Yes, good morning and welcome to Kansas Medical Training College. I always like to start the day by giving you a little nugget. Today, our nugget is you will never change your life until you change something you do daily. You will never change your life until you change something you do daily. The secret of your success is found in your daily routine. That is something you have to think about. Okay, without wasting time, let's dive in. We're gonna look at some things we call test taking strategies. For instance, as a CNA student, you end up doing a state test. You are required to do the state boards, and probably it's computerized tests. Sometimes you are required to do skills test. Here in Kansas, you just need to do a state test, which is computerized, multiple choice questions. Now, they want you to know about so much in the curriculum. But one thing I would urge you to make sure you understand is the test taking strategies. For instance, you have 4 choices and you have to really choose the one that you feel is the best or the one that you have been prepared to choose as the best answer. For instance, why is diarrhea a serious concern in older adults? You have to think about, you're talking about older adults and diarrhea. Why is it a serious concern? One of the choices we have, it increases activity, it causes diarrhea, or it causes dehydration, it causes odor, and it causes skin breakdown. So the best answer to choose there will be it causes dehydration. How about this one here? The person receiving an enema is usually placed in which position? A person receiving enema is usually placed in which position? Here, we want to find out whether you understand all the positions that patients may be sleeping or may be laying in a bed. Some of those positions will be Fowler's position, semi-Fowler's position, Sims position, supine position, prone position. Just know that you know all these positions. Now for this one here, a person receiving an enema will be laying in which position? Give you some time. The correct answer is Sims position. Sims position is whereby you are laying flat on the bed and then you bring your knee close to your chest, and that gives your nurse or the caregiver an opportunity to place an enema on the backside of you. Good. To lift an object using good body mechanics, the nurse or the CNA should do what? Here, they're talking about safety. They want to make sure that you know how to lift objects in a safe way. Keep both feet close together. Bend knees and keep the back straight. Hold the object away from the body or lift with abdominal muscles. The most important thing here is to know that lifting object requires good body mechanics, and we want to increase the base or rather make it wide. So putting the feet together is not the best answer. Bending the knees and keep back straight. Hold the object away from the body. You want the object to be close to the gravity. Lift using abdominal muscles. No, we never use abdominal muscles. So the best one here will be bending the knee and keeping your body straight so that you can lift with your leg muscles. Good. While eating dinner, a client or a patient becomes blue and is choking. What should you do? You should actually activate emergency response or call for help, but immediately you must start performing abdominal thrust. You must start performing abdominal thrust. That is why they used to call it Heimlich maneuver. This is taught in cardiopulmonary resuscitation. By the way, I'm a CPR instructor, so in case you need certification for BLS from American Heart Association, just tell us. We will do that for you in KMTC. Good. A nurse aide is going to help the client walk from bed to chair. What should the nurse aide put on the client's feet? This is very, very important. Anytime that you are pushing a patient around the building or on the hallways, at the feet, you must make sure that those leg rests are in place so that in case a patient was to stop, they're not gonna flip over and fall on their face. So the leg rest should be they should be important there if you're wheeling the patient. But if you're walking the patient, make sure that they are wearing rubber-soled slippers or shoes, or rather what you call non-skid footwear to prevent falls. Let's talk about this. Communication is one of my best topics to teach. So when communicating with the client's family, you should listen and offer support. Yes, listening is a good thing. Anything that you're told to listen, that's good. Offer advice about client's medical treatment. You might not be doing that. You should not be offering support. You might not be offering the advice because you're not actually a medical doctor. Get involved in family problems. Trust me, there are people who like to be involved in other people's problems. You're not getting paid to get involved in people's problems. Share the latest facility gossip. No, you should not be doing that. So the best option there is to listen to concerns and offer support. Now, I have two more questions here. The nurse aide is working with a client confined to a wheelchair when the facility fire alarm goes on. The client becomes excited from the noise. The nurse should do what? Or the CNA. Push the wheelchair out of the way, comfort the client when moving to a safe place, leave the client to search for help, lock the chair and check the surrounding area for smoke. You cannot lock the chair and go looking for the smoke. You cannot leave the client unattended, but you can comfort the client when moving to a safe place. Say, Mrs. Jones, sorry, the alarm is going off, let's go. You must have a designated area that you're moving to. We have two more questions. The nurse aide sees a client spill water on the hallway. What should you do? You should actually stop and clean up the mess. Because if there is water in the hallway, you cannot leave there. You cannot go call the nurse. You cannot leave the spill laying there. You must clean it so that you avoid somebody else to fall. How about a confused client is confused and is begging to go home? The nurse aide's best response to the client is doing what? We're talking about a dementia possible client here who is saying that they want to go home. Should you tell the client that this is your home? No. Would you tell the client, take the client to the activity room? Actually not, because that's not their home. Ask the client to tell the nurse aide about his or her home. Tell the client to take you home later. You should ask the client to tell the nurse more about their home. You know, you're telling, tell me more about it. That way you're distracting the patient or the resident from that thought of going home. Last one. Who is a physician who specializes in the heart, or in the heart is referred to what? We have radiologist, cardiologist, phlebotomist, or oncologist. It's very good to know what your healthcare team members do. The one who specializes on your heart is called a cardiologist. You can hear the word cardiologist. Thank you so much. You can subscribe to our YouTube channel so that we can continue learning more. And we have more questions about preparing for the test. Thank you.